Thank you so much for having me. I really appreciate the opportunity to come and speak. I hope, is there anybody from HHS or FDA in the audience? Yay, okay, that's fabulous. Because we didn't do it alone. So I wanted to talk a little bit about both the how to do this and the why, because I think, and certainly my colleagues from the FDA can really live this every day. You know, these are the question that we're always dealing with when we're talking about a healthcare product is what's the benefit and what's the risk? And with some consumer health products, including our own, that benefit may take years to really come to fruition, and it can be very hypothetical, but some of the risks can be very prescient and very real. So how to do that, I think, is something that we increasingly need to understand and be thoughtful as we think about both the risk and benefit from the industry side and from the government side. So for those of you who may not know, 23andMe is a consumer genetics company. And our mission is really around health genetics. We do provide ancestry information and some fun stuff, but the mission of our founder, Ann Wojcicki, and the company, my 650 fellow employees, is to make people improve their lives by giving them information in a cheap and easy and accurate way that can alert them to the fact that they might have certain higher risks for certain genetically driven diseases. So in case there's anybody in the audience who doesn't know, in November of 2013, 23andMe got a warning letter from the FDA, and it is one of the most read warning letters I think the agency's ever issued. It still, I think, is a chart topper. That's actually what brought me to the company. I had worked in biotech for a long time, and I had worked both at medical device companies as well as at clinical laboratory companies. So I was on the West Coast when this happened, although actually when the letter became public, I was actually in a meeting here in DC with OMB and FDA on related topics, but I was not working for 23andMe. That was kind of the shot heard around the world in terms of figuring out how are we going to take a consumer genetic test that is really a process through the FDA when there is not a predicate device and there is not a guidance document. So you can see, obviously, since that time, we have successfully gotten the first in 2015. We got our Bloom syndrome for carrier testing first cleared. Then we got genetic health risks, but for non-cancer. Then we got BRCA, which is a cancer risk. Then we got PGT just recently. That's actually how people metabolize drugs and can alert you to efficacy and side effects in certain drugs. And then more recently, MUT-YH, which is a colon cancer indicator. Oh, next slide. Oh, there we go. So how do we actually get the information to consumers? Well, we're an online company. So we advertise. People generally order online. We send them a collection kit. You spit 3 mLs of saliva into the tube. You send it back to us. And a few weeks later, you're going to get an email saying your results are ready. We don't mail you your information, and we don't email you your results. For those of you who are very into the data security side, that should be obvious as to why we wouldn't do either of those things. You have to log into a secure portal where you put your credentialing in, and that's where your results are then merged together. So we are the first and still the only FDA authorized over-the-counter product. We have really, you can see there, 40 plus carrier tests, as well as 10 plus health results. That does include the BRCA and the MUT-YH results. And what we had to do and work through with our colleagues at the FDA was how do you do this? How do you address the risks, and how do you do it safely? And how do you prove that you can do it safely? So the primary or first risk that was of concern was obviously the accuracy. Nobody thinks it would be appropriate to give people information that could be wrong. So we had to do analytical testing, and we had to set the standard for this. So our analytical standard through those FDA reviews is a 99% negative predictive value and a 99% positive predictive value with a 95% confidence interval. So that means we've had to test a lot of samples for each of these markers to prove that, you know, if we say that something is present or we say that something is not present, that it's going to be correct in almost all instances, because obviously it's much easier to mitigate the other risks if you first have a very robust analytical performance in the product, and it does. In addition, though, because we were selling the information direct to consumer, we had to address the issue of, can people actually handle the information? Can people understand and appropriately use the information? We have one of the few products that's ever had to do user comprehension testing in order to be able to prove this. Another somewhat recent test is the HIV at home test. There is user comprehension tests for that product as well. It has lower comprehension rates, but as you might imagine, the benefit potentially to the public health of people getting HIV information in a confidential way when people were reluctant perhaps to go to the doctor, there's a public health benefit that exists there, and our benefit is more on an individual level. So we had to demonstrate user comprehension to 90% or higher across the whole US demography. So we've done numerous studies. These are studies that are done across all age groups, all ethnicities, gender, and then also education levels. So people with some high school and people all the way up to postgraduate education. That's really to show that if somebody gets our information, that they can appropriately use the information. Most people, some of these genetic conditions are quite rare, so we don't expect that huge numbers of people will actually get a positive. Some will. We want those individuals to know that it's not a diagnosis. It might mean you have a higher risk of breast cancer or Parkinson's disease, but it does not necessarily mean that you will have the disease. We want you to go and talk to your own physician about that and follow up. And for people who get a negative, we importantly, and I think this is one of the primary concerns the agency had, we want to make sure that they don't think that that means that they have no risk for breast cancer. Most breast cancer, most diseases have other causes beyond the genetic factors. So just a couple of report examples, and I'll go through these really quickly. This is what it looks like. To get the user comprehension, we have a team of fantastic product scientists who went through iterative rounds with consumers to figure out what combination of words and artwork and emphasis and de-emphasis do you have to do to make people be able to understand that. So there's really quite a lot of science that went into it, and some of it was sometimes surprising to us. I think from a regulatory perspective, you know, I've written a lot of warnings and warning letters and limitations and things like that. There's a tendency, certainly from my side of the profession, to load words onto things. It actually lowers comprehension. What you want to identify is what's the key concept, and then you really want to focus on it, and that means sometimes taking away some of the words. There's a sample wellness report. These are low risk, so these don't go through FDA for a pre-market perspective, but they're very interesting to consumers. Some of the things that you know, people might be interested in is what their sleep patterns are, what the genetic information around their sleep patterns might look like. And then in addition, we have some traits. People sort of realize that they look like members of their family. Some things are very inherited: widow's peak, freckles, eye color, whether your hair is curly. Those things can be interesting to people. Many times they're visually observable, but understanding, oh, I inherited that from my mother's side of the family is kind of an interesting thing. And then we also do provide ancestry information. Some customers only buy ancestry reports from us. All of our health customers have access to their ancestry. There are some interesting tie-ins here. I usually show my own slide because I have a small amount of African American DNA, which is really not a surprise for somebody whose family's been in the US for as long as mine has. And many people have ancestry that surprises them. So one of our favorite stories are stories like this, where a family is reunited. In this instance, it's a man who had had a child with a girlfriend when he was young, had lost contact, had never actually met the baby. He, unfortunately, becomes a racist, is actually a member of some groups in that regard. His daughter then finds him through 23andMe. Turns out she is half Jewish, and she is married to an African-American man and has biracial grandchildren. So he was faced with a conundrum. Would he embrace his family or keep his historical racist friends? And he embraced his family. So it's kind of fantastic. We went through a little spate a couple of years ago where people were trying to prove they were 100% white, and they stopped doing it because almost no one found out they were 100% white. So we liked that quite a bit. But what's the other benefit that we can get by engaging consumers in their genetic information? It's research. And as I said, the goal of the company is really to expand and empower research. So we now have over 10 million customers. Over 80% of our customers consent to research and participate in research. We obviously have their genetic information, but what we need them to do is actually participate. They answer survey questions for us, and therefore we can get their phenotypic information and we can look in their genetic information. So we can study both what people say about, for example, their sleep patterns or their health or their family health history, and then we can look in their genetics to see if we can find a signature. And we can find a genetic signature. We do find people who we refer to as human knockouts, somebody who has, for example, 2 copies of a cystic fibrosis gene but does not have cystic fibrosis. They're very interesting from a research perspective because it may lead to discoveries about other causes of disease or other ways to prevent disease. So that's why we do that. So our research goals are really to expand what we can tell people about. We refer to it as a virtuous cycle. We give the information back to those consumers who participated in it. If you are a 23andMe customer and you participate in research, you can see which papers your information has been used in. You can go into your account, you can actually track that, and it's easy to consent and then change your mind if you want to. But our goal here is really prevention. The supposition is really that if we can identify people at risk for things that might not be discovered until they have the onset of symptomology, that they'll have a better outcome. So again, already talked about that. We have, I think that number of survey questions answered is even higher now. Oh, this gets really hard for me to see with my nearsightedness, but this is an example of how we ask the questions of individuals. We have more than 100 peer-reviewed scientific papers that we've done ourselves or in collaboration with academics and others at this point. There's a few highlights there. We're very proud of those. And what other discoveries can we make for fun? So I don't know if folks remember the situation several years ago. There was a dress online, and some people thought it was black and gold, and other people thought it was blue. Unfortunately, we could not find a genetic signature for color blindness, but we could find an age-related signature for that. And again, 2 much more serious causes as well. So we engage the consumers in the research cycle to give them access and information, and then give them back information about the research they've participated in, and then hopefully share discoveries with them. When we actually make a discovery, we can issue a new report, and we give that to them. So data does power our reports. As you can imagine, with 10 million customers, we have some really large signatures that we can see. And you can see some fun science plots there. Caffeine, this is a report that we developed after doing the survey work with our consumers to figure out sort of the level of caffeine consumption that somebody might be predisposed to. I am predisposed to this. Polygenic risk development, this is an area that we're working on. We know that, many diseases we have found over the last, 30 years, mutations that have a large effect. So something like BRCA, it's rare, but when it's present, it increases the cancer risk depending on what you're talking about, which cancer and what the ethnicity of the individual is. It can increase a person's risk of cancer by as much as 85%, meaning that that person has an 80%-ish likelihood of getting certain cancers. But other diseases we know have a heredity factor, but there isn't a single gene. So we're increasingly working on polygenic risk scores. Can we figure out what series of genes might increase your risk. So one of those examples is type 2 diabetes. The US population, we as people who live in this country, we all have a population risk of about 20%. But there are certain people and certain families that we know have a higher risk of this. So we've spent quite a bit of time discovering a genetic score to help us identify individuals who are at a higher than population risk of diabetes. I'm conscious of my time, but I want to show you a little bit of this. One of the really interesting things about this is this. Our database is ethnically diverse. It's not as diverse as we'd like it to be, but we work very hard at this. So in our score development, we're actually able to look at people with ethnicities beyond Caucasian ethnicity and beyond Ashkenazi Jewish ethnicity. Most genetic studies historically have been done in a largely European cohort, and because of the prevalence of the carrier testing SNPs in the Ashkenazi Jewish population, many studies are only studied in people with Ashkenazi ancestry. We can look for these signatures and even those genes that have been previously discovered in unique populations across a broad population and actually see that there are people that carry these mutations who would be missed by traditional healthcare tests because we use ethnicity and we use reported ethnicity, not what you might actually be, in the healthcare setting to determine who might be eligible for these tests. So it's very important that we be able to increase the ethnic information and ethnic diversity in doing this. Keep moving a little more quickly. So that's what the report actually looks like. We take pains, obviously, to tell people everyone has a risk of diabetes. It's highly environmental. What we're really trying to motivate people to do is to take better care of themselves. Turns out exercise and a better diet helps pretty much everything, and smoking's good for nothing. There's nothing that's better for. And can this impact behavior? Again, I know I'm late on time, but I want to talk a little bit about this because one of the things that we've actually studied is, do people actually change their behavior if we give them the information and tell them that they're at increased risk? And they do. And we follow up with our consumers. We we go back with survey questions and ask them, have you sustained that behavior change? And many of them have. So we think we can add engagement tools, add trackers, add coaching apps and things like that that can help reinforce this. But there is good signal in the data that indicates that if we identify it, we can help to prevent it, we can motivate the action, and then hopefully we can impact the actual healthcare in the country. So that's 23andMe. That's what we offer, and many thanks to the folks at FDA. This was a lot of work, but I think it's a great example of both the working together of industry and an agency, and then also it's great to see the growth that's come from that. I think the consumer public is very encouraged by the fact that it has been reviewed by the FDA, and I think the healthcare professionals also appreciate especially the level of work that's gone into the results, so that the individuals, they know when they have a person coming to them who has been identified as having one of these markers, they can have confidence in the level of the test, the accuracy, but they also have confidence that they don't have somebody who is rushing in very worried about it without any kind of educational support around it. So thank you very much.